information that a lot of times gets lost or misconstrued amongst young people regarding their reproductive and sexual health. So specifically the Teen Mobile Clinic, which is called Project Contact. Brian, I don't know if you can bring up my PowerPoint, if possible. If not, folks, I will make this available to you all. And so what the team there is. Thank you, Brian. The Teen Mobile Clinic was established in 1999. Its beginnings were to work with at-risk homeless youth here in Tucson, Arizona, in partnership with Our Town Family Center back in the day, which is now Our Family Services. From there, it progressed to the Sunnyside School District because at that time there was a very large amount of young mothers, young teens who were pregnant in that school district. And so the school district approached us about establishing a family planning clinic there on the mobile clinic. And the services that we provide on that clinic, as you can see on this slide, are we provide abstinence and birth control methods, resources and services, STD testing, diagnosis and treatment. We provide, on top of that, folks, we really provide comprehensive reproductive health education and information. And comprehensive includes abstinence. It begins, our appointments begin with abstinence education and also a reproductive life plan, to discuss with these kids. Sometimes they think of the here and now in their reproductive health and sexual health, and we want to think, point out things to them that are very important that they need to be aware of how this can impact their future. Again, one of the big things that I'm a proponent of is making sure that youth are provided factual information. They get a lot of misinformation on the internet and social media, so we point out the correct information to them. The other service that we provide is pregnancy testing, counseling, and referral for any of those teens that find out in their visit that they are pregnant. The next slide discusses what type of services we provide. So our services are funded by Title X. Title X funding is a federal law that was established in 1973 under the Nixon administration, that all individuals, male and female, are provided and have the right to reproductive and sexual health services. Again, majority of teens, there's a statistic that came out on the CDC website in 2018 that nationwide, and especially here in Arizona, 46% of teens by the time they graduate have become sexually active. And I think for us folks, for this program, it is to really provide resources for those kids that choose to become sexually active. We do not promote sexual activity. We do not promote birth control. We provide a resource for those students that have chosen to become sexually active. So our services are non-judgmental, and we meet the client's needs at where they're at. The services are provided on a sliding fee scale. However, we don't turn anyone away if they are not able to pay. All of our services are confidential. Again, we are mandated reporters, so anyone that is, and we all know what those mandates are, being victimization due to sexual abuse or sexual violence. If they are underage and having a relationship with someone overage, we have to report that as well. So, and again, danger to self and danger to others, we have to report those things. One of the things that I under Title X is that youth can seek our reproductive and sexual health services without parental permission. And that is, again, we follow the mandates that have been federally established since 1973. Brian, can you go to the next page, please, sir? So what our funding sources are from the Arizona Family Health Partnership and the Arizona Department of Health Services. So basically, these are the services that are provided, again, to those youth that are 14 to 21 years of age. So again, we talk about reproductive life planning. We give them help them to understand the consequences, the possible consequences that of their choice to become sexually active. We provide factual counseling on reproductive and sexual health, and also factual education. And this information is based on current information and not outdated information. The types of birth control that we provide on the mobile clinic, we provide various types of birth control pills that are available to teens. We also provide condoms, the Depo-Provera shot, which is administered every 3 months. We also provide physical exams for youth in regards to the reproductive and sexual health through a clinician that is based on and assigned to the mobile clinic. Pregnancy testing is also conducted and provided there if needed. Basic infertility services are provided more so in our brick and mortar clinics here at Teresa Lee Public Health Center, and also at North Clinic on First Avenue and Prince. Those are for folks that are seeking and wanting to begin their families and start families. Sometimes there are some difficulties, and that's where the information and referrals are provided for fertility. Amongst one of the two main things, the other aspect of our mobile clinic that we provide is testing and treatment of STIs and HIV. And those the types of infections that we provide testing for and treatment for are chlamydia, gonorrhea, and syphilis. Unfortunately, we provide, if any teens test positive for HIV, we automatically immediately link them into HIV care so that they can begin their antiretroviral medications, and also to provide resources and support services for those individuals, because that can and is a very traumatic event. We want to make sure that they are provided a smooth transition into those services. So how do we test for STIs? Basically, for chlamydia and gonorrhea, we do a urine-based test. There is no, that's the easiest and quickest way to access these. The efficacy or the accuracy of these tests are around 99.4% in regards to all of our testing methods. So chlamydia, gonorrhea is done through a urine-based test. Syphilis and HIV is done through a blood draw. Now, we do provide, one of my other prevention programs provides the rapid 20-minute test with both syphilis and HIV, which again has that same, I believe this one is, those rapid tests are a little more effective. They're about 99.8% correctiveness or efficacy. But with these types of testing, folks, we get the results back within 72 to 3 to 5 days, but usually we get those results back within 48 hours. The other service that we also provide, resource that we provide, is emergency contraception, Plan B. This is not an abortive type of medication. We are prohibited under Title 10, and our clinics do not provide this type of service. We do not provide termination of pregnancy services. We are strictly a reproductive and sexual health resource service provider. Brian, can you go to the next page, please? So where we're located, we have contracts with various school districts. We have them with Sunnyside School District, Tucson Unified School District, as well as various charter schools and other organizations. We provide also at an outpatient substance abuse program for teens in our community. So altogether, we provide services directly on a weekly basis to some of these here. Altogether, we provide them to 11 different locations, and some of those are not listed here. But as you can see, through our formal contracts and approval by both Sunnyside School District and Tucson Unified School District, we're able to provide those services at these schools and more schools, because we are only at 3 or 4 schools within TUSD. We have the capacity to provide those to every high school if asked and requested by those high schools. Last year, just to give you some information off the top of my head, last year we had over, because it was an abbreviated year, we had 532 visits starting from August 1st up to March 13th. We missed 2 months of school of being able to provide this service. The year prior, we served over 700 students with services and resources on our mobile clinic. So again, I look at it as a preventative method and a cost-saving factor to us as taxpayers. And the most importantly is we are providing teens to be able to successfully complete their high school education and more education or more training in the future without having to have the negative effects sometimes of not being prepared to begin having children or contracting STIs in their future, which we definitely do not want that to happen. The next slide, Brian. So this is, we've been running out of a 23-year-old mobile clinic from 1997, and we call that one Randy. Randy's been reliable and just as tough as nails. This is our newest one, our newest edition. And this one is a 2018 Winnebago. It is state-of-the-art, as is Randy. We made modifications in the older mobile, but this is a state-of-the-art mobile clinic on wheels. It is beautiful. If you ever want us to tour, please contact myself, which I will leave on the board, my contact information. There's probably some nurses here that are part of this education consortium that can attest to the level of services and the quality of services that my team provides. The next page, Brian. So every school, in ending, folks, every school receives this flyer in their own individual's school colors. And typically this is found within the nurse's office. We don't disseminate this at the schools. And out of respect, because every family has different a different belief system. But where do kids go for health services? To the school nurse. So we have this with the school nurses or the school representative, if it's a charter school or if it's at that outpatient substance abuse agency, where kids will know. And as you can see on this one, this is an example from Totocali High School, which is one of our partners and has been our partner for many years, that the students can come out to on every third Thursday, Tuesday of the month at the location, and it states on there where the location is at. And on the very bottom, there's also a contact information for the leads, one of my lead staff, Michelle Magana, where they can directly reach out to them if they have questions or if they like to schedule an appointment. We take students as a walk-in basis. However, with the COVID-19 pandemic, we have changed that and are restarting services here in November. So we have been on break since March because of the risk factor of infection. So we are gradually starting those discussions. As of yesterday, we've had a nice meeting with all our partners. And so we are gradually going to begin doing that at neutral sites here in our community. So that pretty much wraps out what the Project Contact Teen Mobile Clinic is about. Again, if you have any questions, please contact me. I will leave my information on the board there. Email is the best way, folks, and I will get back to you as soon as possible. It's kind of difficult, as you well know. We are all very busy, but I always respond. So rest assured that I will give you a response. Thank you, everybody, for your time. I appreciate it. Sorry if I took a little longer. I just wanted to be a little thorough. Thank you, Brian. Appreciate it. And you folks have a great day.
Can everyone hear me okay?
Yes.
Yes.
Oh, oh man,
Yes.
what so frustrating. Okay, Noel, thank you so much for that. And Margaret, I apologize for not being the information there. For everyone on the meeting today, we do have Margaret's information was posted in the chat box, and I believe Noel is posting his email contact information in there as well. You can get more information by calling that number on the slide 940-0165 as well. So those two resources will be coming your way. The one question that is for you, Noel here is, are the posters available to middle schools? And you're
Right
muted, Noel.
here.
So there you
What typically, because teen or middle schoolers are under the age, usually 14 years old is usually freshman year in high school. We don't promote our services because that is underage. And if youth are going to access our services because they are underage, if they're accessing any of our resources and services, we have to report that because we are automatically being told that they are sexually active. And again, according to state law and according to our Title X funders in Arizona under the age of 14, if that is disclosed to us, we have to report. Again, we have had, and I do know this for a fact, for many years, in our brick and mortar clinics, there have been parents that have, and again, every family has different, again, we are non-judgmental, and every family has a different belief system, but there have been parents that have brought in their children who are under the age of 14 because they find out that their child is sexually active and they want to do something to prevent them from contracting an STI or HIV, and also from uh, having an unplanned pregnancy or causing an unplanned pregnancy. So in those cases, we tell them, hey, we have to report this. And they're like, fine, I'm doing this as preventative steps to protect my child. So again, we are non-judgmental, and we provide those services as needed and as requested. So to answer the question, we don't do that. We don't promote in middle schools. Again, when they get to high schools, if they have questions and they need our services, they can always reach out to clinical staff or to the various clinics, the brick and mortar clinics, or to my team or myself here on the mobile clinic.
Thanks, Noel, for that answer.
You're welcome.
Yeah, great. So a couple of other questions I want to address that were in the chat box that I think for the benefit of everyone. The study referenced earlier, or the survey referenced earlier on the Google form that Andrew Bevington had posted in the chat. And Andrew, if you're still on, if you want to repost that link one more time, you can pass that on to any principal, teacher, anyone that you interact with at the districts. The more information we get back, the better it will be, and the more direct that technical assistance in relation to hybrid learning can be provided to your teachers. We do want to make sure that the subject matter experts are covering that content. And I do see that Mr. Bevington just posted that link one more time. So feel free to copy that and share it with your administrators and some of the other teachers you work with so that we can make sure we're getting you the information that you really want to see in terms of that hybrid model. One other question from Sherry. Ms. Gaither there, on the agenda, there was a mistake on the next meeting. The date is Thursday, October 15th, not 16th, and it's at 11 a.m., not 9 a.m. So again, the next meeting will be Thursday, October 15th at 11 a.m. So just make a note of that, please. Everyone on this call, I'm gonna have to just completely rebuild this session from scratch because of the technical difficulties we had today. I'll be working with my IT team and my other team as well to try and get all of this resolved. I had a lot of people who were emailing me and texting me saying they couldn't get in for various reasons. So just note that we're going to be canceling this meeting and I'll be rebuilding a whole new one from scratch, which will just give me better control over the logistical problems that arose today during the presentation. So again, I thank you all for your patience during this extremely challenging and trying time. I was pulling my hair out over here for sure, and now my beard is patchy. Ms. Steinley has a question for Mr. Bevington. Do you have a link to the 1015 workshop that can be shared as well? And I do see that Noel has posted the email address for anyone else to get their questions directly addressed. So,
Ryan, can I answer that question now?
absolutely.
So I'm waiting. So our trainer with the U of A and Pima Community College is working on that, and he's going to get me the link and a bio and a workshop overview, hopefully by 2 o'clock today. I'm hoping to get that link out via email by the close of business today, and that will Brian will help me, I think, to get it out to everyone that's on this call and everyone on his list.
Great. Well, yeah, we will make sure to do that. So everyone on this call expect to get that as soon as we get that forwarded over from Pima Community College. At this point, that concludes the agenda. We may have to redo some of this content in the next agenda, so I apologize for the redundancy on that part. Today was a very important lesson in technical difficulties for me. So yoga and meditation will help resolve my inner peace, right? We will be revisiting the data dashboard on the next agenda item. Just a reminder, the health department will be putting together a specific workshop that'll probably take 15-30 minutes in length, open to any and all in the community in order to attend and learn more about how to utilize that dashboard to seek data. I will be bringing that feedback about the 100,000 cases per 100,000 and the need for graphically displaying that information. A reminder that is going to be implemented into our interface with the graphic that shows the 3 different levels of transmission, whether it's red, yellow, and green. So, and that's for the 9 criteria. So you'll see a new graphic representation of that interface at some point pop up, and that's really where that per 100,000 will show that specific data. I don't know if we can get that by zip code, but that I know that that's probably what's being asked by a lot of folks here in general. So if there's any other questions, just go ahead and post them in the chat. We are 2 minutes from the 12 o'clock mark, which means our time together is over. And I wish that Mr. Rogers here was here to sing a song about goodbye, my friends, things like that. So seeing no other questions at this point, thank you, Kathy. All right, I'm going to go ahead and conclude the meeting at this point. If you have any other future comments, questions, or things that you need us to know about, go ahead and email us at education@pima.gov. Again, that is eoceducation@pima.gov. Thank you for your time and everything that you're doing. We will now conclude the meeting.
Bye. Have a good day.